Now, it's hard to get away from sugar in our diets, and all the warnings about how too much of it is really bad for us. The WHO says making us pay more for things like sugary drinks can actually encourage us to consume less. A growing number of countries are starting to listen to that advice, the latest being Indonesia. Now, it's proposing to impose a 20% excise tax on all packaged sweetened beverages. Now, the government in Jakarta hopes that this will make a real dent in the growing problem of obesity and diabetes.
Sugar. It's everywhere. It's addictive and deadly, but it has also become an integral part of living in Indonesia. It's a common sight to see people adding sugar to food and beverages that are naturally sweet. Like many here, Noviandrini used to have a sweet tooth. But that changed recently after the 50-year-old found out that she was on the verge of getting diabetes.
It's quite difficult to find sugar-free food for diabetics here, but my daughter has found a place. She knows where to buy sugar-free cakes. But in general, it's very difficult for us, especially for diabetics.
In Indonesia, the number of overweight and obese young people has more than doubled in the last 10 years, caused mostly by excessive consumption of sugar. The government's plan to impose an excise tax on sugary products is meeting some resistance. If sugary products become more expensive, fewer people will buy them. Good news for the nation's health, but some fear it could also impact the nation's economic recovery. Olivia Herlinda works for the Center for Indonesia's Strategic Development Initiatives, an NGO specializing in public health policy. She warns the government will have to be careful how it applies the tax when it passes the law.
Sugar excise tax needs to be evenly enforced because countries that did it partly ended up having people looking for cheaper products while not changing the overall sugar consumption levels much.
Apart from the excise tax, the health authorities have also been trying to generate public awareness about diabetes as well as implement an early detection program. Early detection certainly helped Noviandrini. She hopes to avoid the disease by transforming her lifestyle. She'll do it not only for herself, but to live longer for her loved ones.
We can go now to Jakarta and speak with Olivia Herlinda, who is Policy Director at the Center for Indonesia's Strategic Development Initiatives. You also saw her earlier in that report. Welcome to DW News Asia. It seems Indonesians, like many people, have a bit of a sweet tooth. How big of a problem is diabetes, and are the issues like obesity there?
Yeah, hi, hello. In Indonesia, we are among the highest because in Indonesia, diabetes is the third biggest cause of death in Indonesia, and among the world, we rank fourth highest country with diabetes prevalence. So we've seen like increased consumption for the last 2 decades for more than 15 times. Yes, so it's really big. It's a really big problem here in Indonesia.
And it seems like Indonesia too is a really big market for things like sugary drinks. What is the evidence that a tax on drinks like this, which the government wants to introduce, is going to help tackle the problems that you've just outlined?
Yeah, so very recently, I think for the last few years, the government has mentioned a lot about sugar-sweetened beverages tax to be introduced, but until this year, I think it hasn't been started yet. But yeah, they've mentioned it a lot, and our president and minister of finance have included it the plan in our national budget plan in 2023. But yeah, there are still a lot of regulations that we need to develop before we can start the implementation.
And is there evidence that a tax would help reduce sugar consumption?
I mean, in many countries, there are a lot of evidence that we also have already looked into and tried to advocate it to the government. the SSB tax can decrease the consumption of SSBs and introduce the healthier reformulation of beverages in the market. So in Indonesia, recently we've done research on price elasticity, and it shows that it may decrease the demand of people and SSBs when the price increase. So yeah.
Okay. Opponents, and I guess food manufacturers, drink manufacturers would be among them, they will probably argue that this is just another tax on people who can least afford to pay it. How would you respond to that?
Yeah, I mean, there are already like a lot of evidence from countries and studies where it shows that there's a very strong association between the consumption of SSBs to many chronic illnesses, particularly diabetes and obesity. So, there are many countries already implemented the policies and many evaluations done, and they all show positive association to decrease the consumption. And to shift the demand to other much healthier products like mineral water and less sugar beverages as well. So yeah.
Okay, and so you're saying that there is a precedent that's being set by other countries. In the piece that we just watched a little bit earlier, you hinted that manufacturers could use certain kinds of loopholes to get around a sugar tax. What's the best way to make sure that they can't do that?
Well, it's we've seen like from many other issues. Maybe like if I can give an example from tobacco industry, we've seen that they can go around and the political process in the government. So it's hard to manage if the industry has is quite powerful and also affect and influence our political process. So it's hard to say that we can try to influence or affect something that has that much capital. But
Okay.
yeah, I mean, many coalitions and many civil societies are already in favor to push this forward. Yeah.
Gotcha. Thanks so much, Olivia Halinda from the Centre for Indonesia's Strategic Development. Thank you.
Thank you very much.